Dementia is the loss of functioning to an extent that it interferes with one's ability to perform ADLs. Normal cognitive skills such as thinking, remembering, and reasoning are lost. Dementia is not a disease itself, but a set of symptoms. A common symptom of dementia is loss of short-term memory. The objectives of this project is to educate the peers on the national concern regarding the morbidity and cost of Alzheimer's disease, give statistical data on the prevalence, the duration, and the cost of Alzheimer's disease, propose methods to prioritize treatments to increase the quality of care, explain the beneficial nursing interventions based upon educating and recognizing early signs of Alzheimer's disease to achieve optimum healthcare outcomes, and to also inform peers of the resources that are available to aid patients with Alzheimer's disease. Approximately 26 million suffer from Alzheimer's disease worldwide, and the numbers are expected to rise to 106 million by the year 2050. The disease is fatal, with death typically occurring 4 to 8 years after diagnosis, but some patients live for 20 years. Alzheimer's disease is the only cause of death among the top 10 in US that cannot be prevented or cured. All we can do as healthcare professionals is slow the progression of this debilitating disease. The direct and indirect cost of dementia in 2010 among those aged 70 years or older in the US alone totaled about $180 billion. Alzheimer's disease is the most common form of dementia, accounting for 60 to 80% of all cases. It is a chronic progressive degenerative disease of the brain which causes a permanent damage, resulting in problems with memory, intelligence, judgment, language, and behavior. The exact etiologies for AD is unknown. However, there are several hypotheses. Combinations of genetic and environmental factors can often predispose the individual for AD. Some individuals show a pattern of inheritance within the family. There are also changes in the brain structure and function in patients with AD. Amyloid plaques, which consist of clusters of insoluble deposits of protein, remnants of neurons, and non-nerve cells, cause damage to the brain tissue. Plaques first affect the areas with memory and cognitive function, as evidenced by the early signs and symptoms of AD. Neurofibrillary tangles are abnormal collections of twisted protein threads inside the nerve cells. Tau proteins, which are a main component that provides support for the intracellular structure, are altered and causes microtubules to twist together in a helical fashion, causing neurofibrillary tangles. People develop some plaques and neurofibrillary tangles as a natural part of aging. However, in AD patients, larger amount of plaque and tangles develop in parts of their brain. Also, there are structural damage and eventual death of the neurons that cause loss of connections between the neurons. With progression of the disease, the affected parts of the brain atrophies and the brain tissue shrinks significantly. There are also genetic markers such as beta amyloid protein and ApoE gene that are associated with AD. However, the presence of these factors alone is not adequate to diagnose a person with AD, and you need a comprehensive exam. And finally, aging and inflammation is another theory.
Risk factors. Age is the most important risk factor for developing Alzheimer's disease. A small percentage of people younger than 60 develop Alzheimer's disease, but is more prevalent in ages 65 and older. 11% of people aged 65 and older, and nearly one-third of those over age 85 have Alzheimer's disease. First-degree relatives with dementia are more likely to develop the disease. People with more than one first-degree relative with dementia are at higher risk of developing Alzheimer's disease. The risk of Alzheimer's disease doubles every 5 years after the age of 65. Early recognition of symptoms and disease is the key to effective treatment and the care of dementias. Research evidence suggests that factors such as any cardiovascular disease may increase the chance of developing Alzheimer's disease, and a factor that may help to delay the progression of this disease is exercise. There are no definitive diagnostic tests for Alzheimer's disease. Diagnosis is primarily a diagnosis of exclusion. A diagnosis of Alzheimer's disease can only be confirmed after death by linking clinical measures with examination of the brain tissue during an autopsy. However, early diagnosis can help caregivers and family members create a better treatment plan in conjunction with the healthcare providers who can develop treatment plans and provide support as well as financial, emotional, and psychological guidance. Since there is no single definitive medical test, arriving at a correct diagnosis takes time and patience. Arrival at a diagnosis includes a thorough history including symptoms obtained from either the patient themselves or a spouse, family members. The healthcare provider looks for classic patterns related to Alzheimer's and differentiates between other forms of dementia. A focused assessment for Alzheimer's would include addressing the following, such as memory issues, immediate recall, short-term memory, thinking deficits regarding the expression of comprehension of language, identification of familiar objects through senses, poor coordination, muscle function, or gait, and the ability to plan, organize, and make judgments. Decline in functioning that is severe enough to interfere with relationships or work performance. A physical and neurological examination that includes cognitive tests that assess orientation, attention span, speed of information processing, working memory, mood, and personality. It is found to be helpful when a family member is present for this examination, especially if the Alzheimer's disease patient is expected to ensure that all information being presented is accurate as well as clarified normal.
Early warning signs of Alzheimer's disease. Memory loss is the most common symptom in which the patient will have problem retaining what it was just learned, such as dates, names, and events. The patient begins to make more mistakes and makes poor decisions. They have a problem with ordinary tasks such as ADLs, but also experience difficulty within the home with something as simple as getting ready for the day. They routinely place important items in odd places, such as keys in the fridge or wallet in the dishwasher. They forget the normal spot for a certain item and do not have the ability to recall where it was originally placed. They frequently forget entire conversations. Patients experience dysarthria and have a problem with vocabulary as well as difficulty finding the words to express. As mentioned earlier, the patient misplaces important items and forgets where they came from as well as where they last put it. However, the struggle goes beyond not being able to find a certain thing, such as a recipe, because once they do, a new obstacle is created. They have to ask themselves, now what do I do with this? The recipe can be right in front of them, but they experience difficulty following directions, especially those that require critical thinking or when numbers are involved. The patient may be less involved with friends and family. They slowly begin to start participating in their usual interests and activities. The patient begins displaying a withdrawn behavior and may sit in front of the TV for hours or sleep far more than usual. They get lost in familiar places, don't remember how they got there or how they got home. Patient may get disoriented to time and place. They experience rapid mood swings from tears to rage for no discernible reasons. Patients feel anxious, scared, lonely, irritable, and frustrated. As the disease progresses to the later and more chronic stage, these symptoms start to affect more than just the patient. The forgetfulness causes the patient to miss important events, skip out on plans, and ask the same questions over and over again, along with the emotional toll the disease has on the patient, leading to the extreme mood swings, brings about frustration for the caregiver. This is another reason why caring for the caregiver is important when dealing with the diagnosis of Alzheimer's disease. If not addressed, this frustration can drive a wedge between the patient and family member caregiver, further leading to a strained relationship, altered family unit, and overall compromising the care the patient is going to receive at home.
Our goal for Healthy People 2020 is to reduce the financial burden and enhance a quality of life for patients and family or caregivers affected by Alzheimer's disease. Nurses need to serve as advocates and be vigilant of the signs and symptoms for early diagnosis as well as education so that patients are aware of the symptoms and can report to their healthcare providers in a timely manner, therefore slowing the progression and preventing hospitalizations that tend to occur more frequently when patients are diagnosed late. Healthy People 2020 has set a goal to increase the awareness of Alzheimer's disease from 34.8% to 38.3%. They would also like to decrease the preventable hospitalizations from 25.3% to 22.8%.
Prioritizing treatment goals. Early recognition and diagnosis is the key to slow the progression of cognitive dysfunction experienced with Alzheimer's disease. Educating family and caregivers will improve the quality of life for both the patient and the caregiver. Developing a relationship with family and caregiver will help to support and provide the appropriate tools needed to cope with the stress and challenges that come about when caring for a patient with Alzheimer's disease. Slowing the progression. With increasing numbers of Alzheimer's disease diagnosis, more emphasis is put on the healthcare professionals in early detection of the disease. Early detection is the first step towards the management and treatment of Alzheimer's disease, allowing patients and caregivers a chance to slow the progression. This is accomplished by treating symptoms associated with the early stages as well as assisting patients and family members to cope and plan for the future. Current medicine does not provide us with the tools to screen Alzheimer's disease directly. However, we can use several methods to aid with early detection and delaying the progression. These treatments will not prevent Alzheimer's from progressing, but if diagnosed early enough, they will delay the onset of more debilitating symptoms as well as help prolong independence. Training the interprofessional team about the disease is one method used to approach Alzheimer's disease treatment. In one study, the author established a training program for the medical and nurse practitioner students to increase their knowledge of Alzheimer's disease. Observe how the interdisciplinary team works together in treating Alzheimer's disease patients and support patients and caregivers throughout the program. This program proved to be a success in increasing awareness and knowledge of the disease while also improving attitudes within the team and the families. This can serve as guide in instituting educational programs early on and also for the healthcare teams in hospitals to be best accomplish early detection of the disease and slow its progression. There are multiple research that study the impact of physical activity on Alzheimer's disease. In one study, the author tested their hypothesis that physical activity may have positive effects on the cognitive function and may have a slowing effect on the neuropathology in Alzheimer's disease. The study concluded that physical activity helps with increasing the synaptic function that are needed for the neural impulses and also decreases systemic inflammation and improves immune function. In another study, the authors studied the impact of exercise and mobility, physical function, and complications. They set up a program which included structured physical exercises of 1 hour twice weekly for a year with physiotherapists. These results show physical exercise delay deterioration in overall physical and motor functioning, and the falls were least frequent. These findings suggest that structured physical activities should be incorporated into the weekly activities and should be continued for as long as possible.
A person-centered care approach is shown to work best with an Alzheimer's disease patient. In an article by Carlson, they interviewed 9 patients with Alzheimer's disease who described their own subjective accounts of their life from childhood to current times. They described the disease process, how they adjusted to difficult situations, and the level of happiness within their current situation. Patients displayed overall contentment, connectedness with the family and their community, strong self-resilience, and increased personal growth throughout the course of their disease. However, in regards to how the AD patient views the present situation, expressions of sadness and disappointment disappointment became a common theme. One participant described Alzheimer's as living in another world with a lot of blue feelings. Another expressed how he feels he is annoying his wife and tries to find things to occupy his time and give her space. Two participants expressed feeling abandoned as they retired early due to the disease and felt there was no support from their employers or former colleagues. The life story work model can be helpful in understanding the subjective experience of the Alzheimer's disease patient. Furthermore, it can be utilized to enhance the sense of self, support the identity, and establish specific goals tailored to the patient.
Support and educate caregivers. Educating family members and caregivers about the signs and symptoms of early, mid, and late stage of Alzheimer's disease is important because each stage requires different care approach. Education about the disease will give realistic and reasonable expectations and can lessen the stress, frustration, and challenges to family members when giving care. Education or early diagnosis will facilitate family members or caregivers to plan ahead and help reduce morbidity and costs. The emotional toll of Alzheimer's disease takes on the family caregiver. It's overwhelming and can be scary as they begin to see their loved one, how they deteriorate, and how they feel no longer who they are. As nurses, we can educate, support, and help family members cope and care for their loved ones with Alzheimer's disease. Short-term memory loss. Teach caregiver to encourage the loved one to use a notebook and create a to-do list each morning and carry with him or her. Advise them to keep daily items in easy-to-remember places, such as keys on the hook by the door, address book by the phone. Avoid asking questions that challenge their short-term memory. Language problems. Patience is the key. The Alzheimer's patient has difficulty recalling words and getting anxious or frustrated with only further inhibiting recall. Teach caregivers to supply the word or gently tell their loved ones when to come back to later. It is important to encourage social interaction to prevent further disease progression. Communication. Teach the caregiver to speak slowly so the patient has more time to process what is being said. Use simple statements with fewer words. Remind caregiver that patient also responds to body language, facial expressions, and tone of voice. Depression. Depression symptoms such as agitation, withdrawal, and changes in sleep patterns are common among the early stage. It is comforting for the caregiver to know that depression is curable. Make the person feel safe and supported while creating a calm environment to ease agitation and boost the outlook. Spending time with the Alzheimer's disease patient and providing opportunities to talk about their fears or emotions while actively listening will enhance the relationship between patient and caregiver and, more importantly, improve the quality of care for the patient who's receiving within the home. The knowledge of the disease can help caregivers slow the progression of the disease by modifying risk factors and helping to maintain their current cognitive physical function by introducing other cognitive and physical activities. Also, making the right referrals such as support services, assistance, support groups, online communities, and other services is beneficial and can provide caregiver the skills necessary when caring for a patient with Alzheimer's disease, reducing physical burden and depression, and help achieve a better quality of life for both the recipient and caregivers.
More nursing responsibilities. Memory aids, such as calendars, clocks, and alarms, prove to be helpful in the early stages of Alzheimer's disease. Screening for depression. Nurses are in an important position to assess for depression and need to be familiar with the warning signs to provide early interventions. It is common for the patient to hide their mistakes in the beginning as they still have enough cognitive ability to recognize how wrong what they did was. Furthermore, caregivers may also be in denial and not seek medical attention early on. As you can assume, this is detrimental to the patient affected by Alzheimer's disease because they are missing the opportunity for early treatment and intervention. Time is a big factor in Alzheimer's disease, and as mentioned, the earlier the disease is diagnosed, the better the treatment outcome. Providing resources. Adult daycare centers have been found to be beneficial for both patient and caregivers. Most importantly, these centers offer a safe environment to keep control of the wandering behavior. They also provide some respite care for the caregiver, as they have the opportunity to take care of themselves and the things they need to get done for themselves, such as run errands, rest, pamper themselves, or anything that helps them relax as they have a break from their stressful caregiving environment. It also gives patients time to interact with others and make new friends while participating in activities that are beneficial for both their physical and mental health, including music, art, and exercise programs. The caregiver can further relax knowing their loved one is in good hand, as the staff is trained to pay attention and look for signs of dangerous behaviors or situations within the environment. These facilities vary from state to state, but in some states these services are even covered by Medicaid. Teach the caregivers about appropriate safety within the home. This would include well-lit stairwells, handrails, no-throw rugs or extension cords, non-skid mats for the shower, and a lock for the doors to the outside, preventing wandering out of the home. Labeling drawers and faucets hot and cold to ensure safety, developing effective diversion strategies to cope with behavioral problems, help caregiver to identify and reduce potential triggers for disruptive behaviors such as stress, unfamiliar environments, or temperature extremes. Also, teach caregivers to provide memory triggers throughout their loved one's environment, such as pictures of family and friends or an old favorite book. Long-term care facilities are eventually going to be necessary. Disease progression results in the demands on the caregiver exceeding their resources, and most patients have to be placed in these facilities in order to manage their care in a safe way while still providing efforts to maintain their quality of life despite their need for total care. When patients reach a severe stage, the nurse's responsibilities change and include providing the care to meet the AD patient's need, including oral, skin, hygiene, and incontinence care, promoting communication through conversation and touch, and providing support and information to the family as well as caregivers surrounding their loved one's condition. Innovative care methods. Memory care communities. Residents may live in semi-private apartments or private rooms that have structured activities delivered by staff members trained specifically on caring for those with memory impairment. There's actually a place that kind of does this. It's called Virtual Village. It's in the Netherlands, and it's a small community built specifically to cater the needs for Alzheimer's disease patients. The environment mimics a small town just like any other, but in reality is a more controlled environment. This ensures they are safe and promotes interaction between other patients dealing with the same thing, as well as making them feel part of the community. There's a small center square surrounded by little apartments, all with glass doors that face the courtyard, allowing the sun to come in and helping make the patients aware of the time of day. The patients will even go outside and interact throughout the day, while also participating in the structured activities, exercise, and walking around in the fresh air. They even have a grocery store within the village. Another innovative care method is a fake bus stop. As safety is a major concern with Alzheimer's disease patients, especially when one displays more wandering and agnosia, German nursing homes created a phantom bus stop to help the wandering associated with Alzheimer's disease. It challenges what patients can recall and has proven to the healthcare professionals that they know what the bus sign means and remember that waiting there means they are about to go home. This helps the patients from forgetting where they were going and keeps them safe within the nursing home facility at that bus stop. The healthcare workers will approach the Alzheimer's disease patient and start to conversate with them, offering some coffee or tea, and 5 minutes later they forget they had ever wanted to leave in the first place. In conclusion, early education and intervention is a critical role for nurses and the rest of the healthcare team to provide assistance and ensure that all patients and caregivers have the highest quality and affordable life. Preventing hospitalizations and prolonging the need for intensive care through early intervention and education will further decrease the medical expenses associated with Alzheimer's disease.